So I recently had a call from a gentleman who was requesting an appointment for himself and his wife. His wife was pregnant and he was worried about the pregnancy and the baby, and he also wanted to make sure that he was okay. Actually, in the news we've seen more stories about whooping cough and the incidence of it rising in the UK. So why is that? What is whooping cough? How does it affect people? What can we do about it? So whooping cough is a very contagious respiratory infection. What it is a droplet infection. That means it's spread by coughing and sneezing. So if you're in close proximity with someone who has whooping cough and they cough or sneeze and you're near them, it's quite likely that you will catch it from them. Equally, if the droplets from the coughing or sneezing land on a surface like the worktop and you touch that surface, then you don't wash your hands and then touch your face, you may again contract the whooping cough from that. So it's extremely contagious. That's the first thing that we need to know, and very easily spread. Whooping cough is due to a bacterium called Bordetella pertussis. This is spread at any time of the year, but often more so in the winter time. However, as I've said, recently we're seeing increased cases of this. So who is at risk of catching whooping cough? Well, the biggest group is young babies and infants. They are the most vulnerable. Their immune system is not as developed as adults, and they are the most vulnerable of catching whooping cough. Also, they will not be vaccinated when they're born. The vaccination schedule starts later on. In keeping with that, if they've started their vaccination and they haven't completed the whole course, again, they're more at risk. Then we move on to those with a weakened immune system, the very old, or those who are on immunosuppressant therapies, chemotherapy, steroids, etc. They are more risk of catching whooping cough as well. So during pregnancy, you are more at risk of catching whooping cough, and that's why we vaccinate pregnant women against this. And there may be some communities where vaccination uptake is lower. So when you get whooping cough, what are the symptoms? Well, at the beginning, it's very like a common cold, what we call the catarrhal syndrome. So coughing, sneezing, runny nose, that kind of thing. Very common and sometimes hard to understand that it is whooping cough. So the next stage is what's called the paroxysmal stage. This is where the disease gets its name from, whooping cough. You have long fits of coughing that last several seconds, maybe even up to a minute. And at the end, you have the characteristic whooping noise that gives this disease its name. In China, whooping cough is termed the 100-day cough, because the cough can go on for weeks and weeks, up to a period of sometimes 100 days. Then you will have what's called the recovery stage. This itself can also last several months. So overall, the whole course of the disease can last several months at a time, 4 or 5 months, and you can be really quite unwell with it. So it's not a pleasant disease to have. So if you have whooping cough, what can you do about it? Well, in the acute stage, when the infection is beginning, it's very important to try and get antibiotics. And that's what I did with the husband and wife that I saw. I went to see them, gave them antibiotics, and hopefully nipped it in the bud. There are certain classes of antibiotics that are more effective than others. That's something that you can discuss with the doctor. If you don't have whooping cough, what's the best way to prevent it? Get the vaccination. This is normally given in what's called your primary childhood vaccinations. This will be administered by your GP, and then you'll get a number of shots of the whooping cough vaccine over a determined period of time. If you become very unwell with whooping cough, you may need to be admitted to hospital, because you may need things like oxygen and IV fluids, and the only place where you can get this is in the hospital setting. So I mentioned that recently we've seen increased incidence of whooping cough in the UK. The primary reason is that parents are reluctant to give their children the vaccination due to misunderstanding and misinformation about this. The vaccine has been around a long time, decades and decades, and it's an extremely safe and effective vaccination. So I can assure you that it's perfectly fine to give to your child. But another thing to bear in mind is that some vaccinations, the effectiveness over years decreases. So you do need booster shots. So you'll have a booster shot at later periods in your life. And sometimes when you go away on holiday, as people move closer and closer together in cities, you're living in proximity to others, and this obviously increases the risk of transmission of any sort of infection. So this may be another factor in the increased incidence of whooping cough. And sort of related to that is, as global travel becomes easier, people are coming from other countries where vaccination may not be so prevalent, and they're bringing the infection here as well. So in conclusion, whooping cough is a serious disease and should not be taken lightly, but we have very effective ways of dealing with it. The first and foremost and most important is to vaccinate your child as an infant. This way you minimize the risk of them contracting this disease, which can be very unpleasant and can in some cases actually be really quite severe. So please do not hesitate to seek medical advice, get your child vaccinated, and if you have any questions, reach out to your doctor. I'm sure they'll be happy to explain it to you. So I hope you found this information useful. If you do have any further questions, or you'd like to have the vaccination itself, do reach out to me and I'll be happy to help you with that. Make sure you subscribe to the channel, and remember, true wealth is health.